Um, this past Monday, we sent out a PDF of the Health Belief Toolkit to everyone that was registered for today's webinar. If you registered after Monday or you didn't receive the PDF is available to download now in the bottom right-hand side of your screen. Simply click the file and then click download the download file button. You'll be able to then save the file to your computer, and then just be sure to come back to the webinar after downloading so you can view the presentation. And the last thing I would like to mention is that this webinar is being recorded. Okay, and with that, I'm now going to pass it off to Catalina Booth.
Thank you. Welcome, everybody, to today's webinar. My name is Catalina Booth, and I am with the Cultural and Linguistic Hub of the Technical Assistance Network for Children's Behavioral Health, also known as the CLC Hub. We are in partnership, a partnership between the Department of Child and Family Studies at the University of South Florida and the Center for Community Learning. The CLC Hub works with a diverse selection of system of care communities throughout the United States, and we provide information, training, technical assistance in the area of cultural and linguistic competence. Today's webinar, an overview of the Health Belief Toolkit, is part of the CLAS Standards Implementation Series. This series will feature 2 webinars on key sections of the enhanced CLAS standards. In addition to the webinars, you will receive two toolkits to help you implement the CLAS standards in your organization, and we will have some follow-up learning exchange calls. Today's webinar focuses on the health belief components of CLAS standard number 1. The second webinar, which will be next month on November 5th, is entitled An Overview of the Language Assistance Toolkit, and it will focus on CLAS standards 5, 6, 7, and 8 on the language assistance portion of those standards. And then, as I mentioned, we will have 4 learning exchange calls on November 6th, December 4th, January 8th, and February 5th. More information about those and registration can be found in the TA Telegram. And in addition, in 2015, we will introduce an online course focusing on health beliefs and language assistance. Now, let's begin the webinar with introductions of today's presenters. Today, you're going to hear from 2 members of Vivian Consulting. Vivian Consulting was founded in 2003 by Dr. Maritza Concha and Dr. Maria Elena Villar. Vivian Consulting offers services in program evaluation, research, capacity building, and communication. For the past 13 years, co-founder Dr. Maritza Concha has been working as an evaluator for local nonprofits serving Latino and Hispanic immigrants. Dr. Concha is also an adjunct professor at the University of Central Florida and Notre Dame, where she teaches graduate and undergraduate courses on nonprofit administration, program evaluation, and research methods. In addition, you will hear from Patricia Rogier, a researcher for Vivian Consulting. She has extensive experience in developing tools for various populations, such as vulnerable youth with mental health issues. She also has experience as a case manager for Wraparound Delaware. And with that, I will turn it over to Maritza and Patricia.
Thank you. This is Patricia Herodier from Vivian Consulting, and I will serve as a facilitator for this webinar. I will pass the presentation to my colleague, Dr. Maritza Concha, throughout the webinar. This webinar will last approximately 60 minutes and will cover the following topics: CLAS standards, behavioral health beliefs, a continuum of understanding health beliefs, behavioral health belief tools and assessments, a practitioner's reflection, an action implementation plan, and finally, 2 service delivery vignettes. The purpose of this webinar is to introduce the Health Belief Toolkit. The Health Belief Toolkit was developed to help behavioral health practitioners recognize and acknowledge the health beliefs and values of individuals in order to increase access to behavioral health services, obtain buy-in of prospective individuals, provide unique service delivery plans according to the beliefs and values of individuals, assess the individual's knowledge of behavioral health illnesses, and reduce healthcare disparities. Dr. Concha, how does the Health Belief Toolkit accomplish these things?
Thank you, Patricia. The toolkit provides the following tools and resources: Behavioral Health Belief Assessments Tool, Practitioner Reflection Assessment Tool, Community Assessment Checklist, organizational policies and procedures checklist, action and implementation plan, access, planning, and service delivery plan vignettes, and community resources.
Therefore, this toolkit is aimed at audiences of behavioral health practitioners, including psychologists, social workers, nurses, case managers, counselors, family intervention specialists, etc., community health practitioners, including community health workers, community educators, community advocates, community leaders, etc., and administrators, including program managers, program directors, board members, etc.
In addition, it can be used by governmental behavioral health care centers, non-governmental behavioral health centers such as community-based organizations, and professional education institutions such as community colleges and universities.
What is the importance of cultural beliefs within the CLAS framework? Current and anticipated demographic changes in the U.S. encourage a renewed focus on addressing racial and ethnic disparities in behavioral health care. The incorporation of behavioral health beliefs is an important part of behavioral health services and systems of care. In order to be effective, medical practitioners, therapists, caseworkers, administrators, and others working with individuals seeking behavioral health services must be conscious of how cultural health beliefs affect disease, treatment, and health practices, as well as how culture influences health and healing practices.
Also, acknowledging and understanding cultural beliefs has become an essential practice in the delivery of behavioral health services. We know that research has shown that incorporated positive health beliefs in the treatment plan of individuals seeking behavioral health services can help reduce healthcare disparities, enabling individuals to achieve desirable health outcomes. Research has also shown that perceptions about behavioral health conditions can either alter or influence an individual's willingness to seek services, as well as to adhere to a treatment plan. Policymakers recognize this need in an effort to provide culturally and linguistically appropriate services. The Office of Minority Health and the U.S. Department of Health and Human Services developed the National Standards for Culturally and Linguistically Appropriate Services, CLAS, back in 2000. The standards were further enhanced in the year of 2013.
The national CLAS standards are designed to advance health equity, improve quality, and eliminate disparities by establishing a blueprint for healthcare organizations so that they may provide effective, equitable, understandable, and respectful quality care and services that are responsive to the diverse cultural health beliefs and practices, preferred language, health literacy, and other community needs.
The principal standard number 1 guides the rationale for the development of this toolkit. It highlights, among many other things, the need for care that is responsive to the diverse health beliefs and practices of individuals seeking behavioral health services. Acknowledging behavioral health services can definitely help reduce healthcare disparities to increase access and utilization of services. Evidence-based data is presented in the introduction section of the toolkit for more information.
Acknowledging behavioral health beliefs can improve access to care by moving from one-size-fits-all to individualized cultures, recognizing generational differences amongst individuals seeking behavioral health care, and addressing individual values and beliefs. Let's explore this a bit further. Attitudes and beliefs may vary in each culture based on sociocultural factors, educational factors, geographical location, health-related topics, family members, and religious affiliations.
So as you can see in this slide, there are a lot of factors that could influence the individual's perspective regarding their own values and beliefs. And that could be influenced by sociocultural factors, your individual customs or lifestyles, educational factors that could be attributed to your educational background, whether you have completed a bachelor degree or a graduate degree, or whether you have only completed high school or have never completed high school. That could also influence the way that you perceive other cultures, and also it could influence your own values and beliefs. Geographical factors, whether you live in urban or rural areas, health-related topics, anything related to the behavioral health diagnosis can also be an important factor that can be related to individualized cultures. family members, the way that parents are raised is also, and parents raise their children is also another way of influencing cultures and religious influence. It could be Catholicism or the role of Islamic or Hinduism or any other type of religion belief can also influence the way that you see or approach things.
Research indicates that age is a predictor of behavioral health symptoms.
Also, behavioral health beliefs may vary greatly between individuals in the same community or ethnic group. In fact, health beliefs may differ within the same culture or family, and this is because beliefs are quite precarious in nature. They always change, they're fluid. And in other words, what an individual believes in his 20s may be different what he believes when she gets older or he gets older. In fact, research in behavioral health has shown that emphasis must be placed on an individual's age, and it has also shown to be a significant predictor of behavioral health symptoms. All generations of individuals, even those in the same culture, may have very diverse behavioral health beliefs. Therefore, when attempting to capture individuals' behavioral health beliefs, the age of individual may influence his or her beliefs.
Incorporating health beliefs into behavioral health practices validates individual beliefs and values.
So when an individual seeking behavioral health services decides to request these services, it is the role of the behavioral health practitioner to provide a welcoming and understanding environment to meet the unique needs of the individuals. So some of the areas that you have to consider is to develop a holistic view of behavioral health issues by incorporating body, mind, and soul. They believe that behavioral health issues may be caused by family relationships or childhood experiences. They believe that behavioral health issues may be caused by supernatural or spiritual factors. They believe that cultural taboos can be associated with when disclosing behavioral health issues and seeking professional help. And knowledge of the individuals regarding the behavioral health illness and how his or her values and beliefs either interfere or promote desirable health behaviors.
We would now like to poll the audience. Adam, would you please poll the first poll question? True or false? Religious beliefs and practices help people cope and deal with stress and are good for mental health.
So let's take about 20 to 30 seconds to answer this statement. All right, so all the audience got it correct. Religious beliefs and practices help people cope and deal with stress and are good for mental health. Definitely, this is really important. Like I said before, religious practice may influence individualized cultures, and we need to start thinking about moving from the one-size-fits-all to a more individualized approach. Can you please?
We have a second poll question. Yes, Adam, if you please. True or false? We never achieve complete understanding of others' behavioral health beliefs.
So now, again, let's take 20 seconds to answer. Okay, so that is correct. We never achieve complete understanding of others' behavioral health beliefs. And this is very similar like cultural competence. When we talk about cultural competence, we are never proficient in terms of learning and completely understanding others' cultures. The same concept applies with behavioral health beliefs. We are always learning. We never stop learning, and we have to keep in mind and always remind ourselves that culture is fluid, is always changing, and therefore we never achieve complete understanding of health beliefs.
Let's now discuss health beliefs. What are health beliefs and how do we understand them? Understanding health beliefs is a process that needs to be explored to effectively incorporate the beliefs of individuals seeking behavioral health care during treatment. This process is cyclical as cultural beliefs may change over time, depending on the health topic that the individual is currently facing: education level, immigration status, community, family, or other situational factors.
So in this webinar, what we're going to do is we're going to walk through all the phases of the continuum. So for phase one, we have the behavioral belief health assessment tools. We have developed a series of tools that we will explain and go over related to health beliefs. Phase two is the self-reflection from the individual's behavioral health beliefs, the practitioner attitudes, and community resources tools. So what do you do after you gather all this information? This is a self-reflection phase. Phase three is the development of action plan and implementation of behavioral belief validation strategies. So after you analyze the information, so what is next? What implementations or what strategies would you utilize to make things happen?
In order to consider health beliefs from a variety of perspectives, an approach known as a triangulated strategy can be used. Triangulation can help practitioners examine health beliefs in the behavioral healthcare setting through three different levels of analysis: the individual level, the organizational level, and the community level.
So from any topic that you are researching or you're focusing on, it's always good to have a triangulated approach, to have a different perspective of the same particular topic, in this case, behavioral health beliefs. So we have the individual level, and under individual level, we have the behavioral health values and beliefs guiding questions tool. Then for the organizational level, we have the behavioral health values and beliefs checklist, as well as the organizational policies and procedures in behavioral health. And then lastly, for the community level, we have the community assessment checklist. So we are trying to incorporate and obtain information from three different levels to ensure that we understand the complexity of health beliefs.
We must provide an individualistic approach for service and treatment delivery. However, providing services and treatment delivery for specific individuals and families is much more difficult than targeting communities or ethnic groups as a whole.
So in order to facilitate this process, a behavioral health values and beliefs guiding questions tool is available within the toolkit. And what is this tool? This tool is a guideline to help start conversations with individuals seeking behavioral health care. Who is it for? It is for caseworkers, counselors, intake specialists, and therapists to administer this at the beginning of any sessions, or the therapy session, or the intake process. And what is it cover? It covers the several dimensions of culture. That includes personal beliefs, family beliefs, spiritual beliefs, community beliefs, knowledge of illness, service delivery expectations, experience with immigration and acculturation, as well as perceptions of behavioral health care services.
Adam, would you be so kind as to share our desktop, please? We will now pull up the Behavioral Health Values and Beliefs Guiding Questions tool that is also available within the toolkit and serves as a guideline for caseworkers, counselors, and other intake specialists and therapists to help start conversations with individuals seeking behavioral health care services.
You guys are able to see the toolkit? Let me just hear from anyone from the chat if you guys are able to see it.
No, it's not being displayed right now.
No? Okay, hold on a second, please. Sorry about that. Just give us a second, please. We're having some technical difficulties. We we have another computer here that we can log in.
Okay, we can see the screen now.
All right, so if you go on page 14 of the toolkit, it's something that able to see in the screen now. We have the behavioral health values and beliefs guiding question. This is to inform the individual that the conversation is confidential, and also he may be willing to either accept or not accept to answer all of the questions. You can see here that there are different dimensions of culture that we took into consideration when we developed this tool. And under personal, familiar, spiritual, community, we have a series of questions. For instance, under personal, one of the questions is, how do you feel about getting the kind of services we provide here? Or what, under spiritual dimension, you can also see what role do your spiritual beliefs play in regaining your health, and so on. If you go all the way down, you'll be able to see service delivery dimensions, immigration, or considered related to acculturation, and also perceptions of healthcare professionals. Something that you have to keep in mind is that add more questions, you can add more dimensions. We just included dimensions that are very recurrent in the literature regarding health beliefs, but you can also add or not decide not to use all of the dimensions that we are presenting in this tool.
Now we will introduce the second assessment tool, which targets practitioners. This is on our toolkit, page 15, section 3.5. How we were raised and the culture we were raised in affects our attitudes, values, and behaviors. In addition, our own thoughts and beliefs affect how we understand others. Therefore, we must recognize that we bring to the table and track different individuals.
So here on section 3.5, what you have to take a look is look internally by acknowledging your socioeconomic status as practitioners. There are so many things that could influence culture, your political affiliation, gender, your role in your family, how do you describe yourself, what is important in your life, your beliefs, spiritual practices, and so on. Like I said before, you can feel free to acknowledge and analyze these factors that influence culture, but you can also add more as you may see it appropriate. The second part is the section B, which is to think about cultural habits, actions that you may have. So how do you greet others? What is safe? How do you dress? Do you practice religion in any way? Who do you consider family? And so on. So questions just to think about internally what will be some of the factors that could influence the way that you see others, but also how are your values and your beliefs. The checklist is after reflecting on personal and shared values, consider the following checklist. How many statements are true for you? So in this section, what you have to do is you have to check whether or not those statements are applicable. For instance, I'm prepared to accept cultural differences that may be between the individual and myself. I agree to address the beliefs of the individual during visits and follow-ups as appropriate. understand the preachers and other spiritual leaders may be important during treatment and recovery. So after you do the self-reflection of section I and V, you're going to go ahead and check whether or not those statements are true.
We have two other tools that we would like to present. First one is on page 18, section 3.6. Again, these tools are provided in the toolkit that coincides with this webinar presentation. The first tool is a community checklist for identifying resources for individuals seeking behavioral health care. Part of building rapport with these different individuals and engaging in a respectful and warm manner is determining the resources available for the individual and his or her family.
All right, so here's in section 3.6. It's the community checklist. So after we have assessed the individual and also you as a practitioner, so what's next? The next phase is to determine what community resources you have available and have already made connections. So you have statements under resources, and the first one is a list whether or not your organization has a list of alternative medicine, like herbal medicine and so on, a list of certified interpreters or certified translators, currently or previously collaborated with community health workers, a list of indigenous healing resources in the community transportation options in the target area to address some of the transportation barriers by many ethnic groups that may face, list of possible daycare centers, and so on. So in this checklist, what you have is that you can either click yes, whether you have that list or the statement is true, no if it's not true or it's not appropriate, and in process is what is actually taking into consideration to make those things happening.
The last tool in this phase is an organizational policies and procedures for behavioral health beliefs checklist, which you can find on page 19, section 3.7. Incorporating behavioral health beliefs into organizational policies is vital for attaining the most effective service planning and treatment. The following is a checklist to be completed by program managers and service delivery staff to ensure that policies and procedures are in place and disseminated throughout the organization.
So in section 3.7 of the toolkit, here we have the organizational policies and procedures to behavioral health beliefs checklist. So we have three different levels of analysis here. We have statements that correspond to the management level, and some of those statements are related to your human resources that are in place in your organization. So for instance, you have whether or not you design of programs, committees, task forces to address behavioral health beliefs across different cultures, acknowledgement of cultural differences and behavioral health beliefs in the organization's mission, vision, and values, whether or not you have your organization lists behavioral health beliefs as a priority in treating individuals. So you can either click yes, no, or in process. And the next one is staff capacity. Here is what is available for your staff, and what does the organization have regarding staff capacity. So hiring and recruiting practices that promote cultural diversity, training practices that include topics related to spiritual beliefs, barriers to access, and individualistic approaches to behavioral health issues. And other things such as the staff members are acknowledged and encouraged to participate in cultural and spiritual celebrations because of their beliefs. Lastly, we have the service delivery level. Service delivery is routinely and systematically reviewed to ensure individual self-beliefs are being appropriately addressed. Cultural bias of service delivery staff is considered when planning and implementing service delivery treatment. And this one is really interesting because what we have done throughout the whole toolkit is that we have, we ensure that we develop tools that meet each other. So in other words, for cultural bias of service delivery staff, you can do the practitioner checklist to ensure that you check your bias and your values that could interfere with the health beliefs of individuals seeking behavioral services.
We would now like to go back to our PowerPoint presentation. Moving into slide 16. the PowerPoint is being uploaded as we speak. One moment, please. Slide 16, please. Thank you. Now we're moving into phase 2 of the continuum. Most of the time, practitioners and even researchers tend to get overwhelmed with the information obtained from these assessments.
So in the slide 16, what you are able to see right now is a table that we have developed, and in order to collect and utilize all the necessary information, you should use categories to highlight beliefs addressed by the individual, use graphics such as tables or figures to accentuate attitudes that influence health beliefs. So what I mean by element 1, 2, 3, 4, and 5, this is a very creative way of analyzing the information that you have obtained from the behavioral health beliefs guiding questions. So for instance, element 1 could be the dimension, the personal dimension from the behavioral health beliefs and guiding questions. Element 2 could be familial dimension. Element 3, spiritual dimension. Element 4, community dimension. Element 5, knowledge of illness. So you can add all of the dimensions from the guiding questions and as one way to analyze this information. The definition is the definition of your dimensions. So for instance, personal 1, you can come up with your own definition. Familiar, you can come up with your own definition of familiar dimension, spiritual, and so on. So under element 1, you could also, besides providing the definition, you can write the answers of the questions being addressed under personal, the answer to the questions being addressed under familiar, the answers to the questions being addressed under spiritual, and so on. So it's just a graphic way for you to understand the questions that are being asked related to the dimensions of the behavioral guiding questions.
Results from the behavioral health values and beliefs guiding questions can be analyzed in different ways. We will be using 2 different models. The first way to evaluate the responses is by using the health belief model.
So the health belief model was developed to explain and predict health behaviors. Originally, the model was used to understand why people did not accept disease prevention or screening tests. Since then, it has been used to understand individuals' responses to symptoms and used with prescribed medical regimes. So there are several dimensions under the health beliefs model. The first one is perceived susceptibility, which is the individual's perception of his or her chances of getting the disease. Seriousness and individual knowledge related to the severity of the disease. Benefits, an individual's opinions of desirable behavioral health beliefs that should be taken into consideration during treatment plans. Barriers, an individual's opinion of what will stop him or her for seeking services. And self-efficacy, an individual's belief that he or she can do something to improve the current situation. So this is another way to analyze the behavioral health values and beliefs guiding questions.
We would now like to go back to the toolkit on page 23. By using the health belief model, practitioners will be able to appreciate individuals' potential for success in treatment, identify the behavioral health beliefs and to access and continuation of treatment, and acknowledge how you can use the individual's behavioral health beliefs to improve treatment adherence and completion.
Okay. So, are you guys able to see, I think so, yes, the toolkit on page 23. So here's the different dimensions: perceived susceptibility, perceived seriousness, benefits, barriers, and self-efficacy. So what we have here is that we have the questions that are the most appropriate questions that we could utilize from the guiding questions that will be better used according to the definition of perceived susceptibility. So one of the questions will be, does anyone among your friends or family also share the same issues as you? Did you seek help? What was the result? The same thing with perceived seriousness. Depending on the definition that we provided, we took some of the questions that meet that definition and we put it under perceived seriousness. What do you know about your current issue that brought you here today? For perceived benefits, we have the same here. How do you feel about getting this kind of services? Will you consider yourself a spiritual person? If yes, explain. Perceived barriers. Do you think you'll be able to resolve your situation and the problems that brought you here today? How do people in your community talk about mental illness? Is there any stigma about the disease? Self-efficacy. Some of the questions that could be used under this dimension are what is most important to you and your family. Think about material things as well as family values. So you can use those questions, and then after using those questions, you can write the answers, so you will have a better understanding of what the health belief model of that particular individual may be.
We will now head back to the PowerPoint presentation, slide number 19. First way of analyzing the information collected. Now let's look at a second way of evaluating the responses using the access model.
Now, access can be defined in multidimensional terms, which could also influence behavioral health behaviors. Think about access in terms of using questions from the behavioral health values and belief assessments related to potential access, realized access, equitable access, and efficient access. So this is another creative way of you to analyze the data from the assessment tool, from the behavioral health values and belief assessment guiding questions. So for instance, if you could see the dimensions and the definitions, again, we always start with defining the dimensions and providing a definition to each dimension. That is really helpful to you to understand what it means, but also to understand which questions will be the most appropriate under each dimension. So for instance, potential access. It means the presence of enabling resources for behavioral health beliefs of the individual. Realized access, actual use of the behavioral health science. Equitable access, an individual's predictors of realized access are dominant. This could be family support networks, demographic, etc. And efficient access, whether or not does it increase or decrease the individual health status and satisfaction. We also have the practitioner reflection, just to continue this discussion. We have questions under each of these dimensions. For instance, under potential access, some of the questions based on the definition of this dimension you can utilize are, does your family support you and your decision to seek help? Realized access, do you think you could get better without professional help? Equitable or inequitable access, what type of social and support networks do you have besides your family? And efficient access, what do you hope to get from your visit with a behavioral health specialist, or how do you feel about the kind of services you will receive here? So once again, there are different ways of analyze this information and interpret it and get the most from this data that you'll be obtaining from this discussion on the guiding questions. One way is to do it by just following the dimensions that are listed under the behavioral health values and beliefs guiding questions. You can also use the behavioral health model, or you can use the access model or another model that you can come up later on.
As we continue our way through phase 2 of the behavioral health continuum, let's reflect on behavioral health beliefs. How can we be more receptive?
So in order to be more receptive to the individual's behavioral health beliefs, you have to become self-aware of your own biases and stereotypes. Realize that what is normal to you may not be seen as normal to others. Have good communication skills, specifically intercultural communication. Be aware of cross-cultural issues. Compromise to find satisfactory solutions, and understand and manage your own emotions.
Reflect on the community resources you did not check in the community checklist. What is keeping you from checking all of these items?
So try to get out in the community and observe cultural habits. In your past to do this, consider doing the following. Ask people from the community or from other organizations about resources they have found useful. Look at what other programs are doing to accommodate the cultures and beliefs of individuals. Try to search for best practices. Stretch beyond your comfort zone. How do people from different groups feel in your community. Try to identify the cultural healers in your community, as well as ask people who do they see as cultural brokers? Who explains American culture to them?
Now let's reflect on organizational policies and procedures for behavioral health beliefs checklist, which should be used as part of their policies and procedures. They should include the behavioral health beliefs of individuals seeking behavioral health care services in their targeted service area at different organizational capacities. Incorporating behavioral health beliefs into policies and procedures provides organizations with a culturally competent approach to addressing the unique needs of individuals, which can then help in removing some of the barriers that minority populations face when seeking and receiving behavioral health care.
So in addition, a cultural competent approach can help organizations provide a more effective and equitable services. After completing the checklist, consider doing the following. Get together with your managers and program directors to discuss your findings. Keep in mind that having the perspectives from the managers and the service deliverers may be different. Do not assume that all staff will understand the policies and procedures the same way. Elicit discussion about what policies and procedures are in place and determine what needs to be done to address unchecked items. Build a task force with community members and other stakeholders to see how policy areas could be improved. Set priorities on the items that have not been checked and incorporate them in the organization's strategic plan.
Here we would like to take a pause and ask you a quick poll question. Adam, please, if you would. True or false? Managers' perception on policies and procedures may be different from the perception of service delivery staff.
Let's take a few seconds to answer this question. Definitely, managers' perception on policies and procedures may be different than the perception of service delivery staff. That is true. When it comes to policies and procedures, the development of policies may be very known by managers, but when it comes to implementation of those policies, the perception of service delivery staff may not really not be well informed whether or not that policy has been implemented or not. So it is very important to keep this in mind, that the perception may vary according to the position of the staff in your organization.
I'd like to go back to slide 24. We're now in phase 3 of the behavioral health continuum. After you reflect on the findings of the behavioral health assessment tools such as behavioral health values and beliefs guiding questions, behavioral health practitioner values and beliefs checklist, community resource checklist, organizational policies and procedures checklist, the next step is to create an action and implementation plan tailored to the unique needs of the individual.
So in this plan, you'll be able to address results from the needs of individuals seeking behavioral health services using the behavioral health belief access model, identify the statements they did not check from the practitioner behavioral health values checklist, and determine how these values and beliefs are similar or different from the individual, as well as identify which community resources you need to have in place to better serve the individuals based on his or unique behavioral health experiences.
We're going to briefly show the action implementation plan that is provided in the Health Beliefs Toolkit. This will be page 42 and 43 of our toolkit.
All right, so we are in the toolkit right now. So if you can see page 42, this is this implementation plan. It's in the appendix section of the toolkit. So here we have the behavioral health values and beliefs guiding questions. So assuming that you use the behavioral health models, then you'll be using all of these dimensions: perceived susceptibility, seriousness, benefits, barriers, and self-efficacy. So under the section of findings, if you use this model, then you will have to write the questions that will fall under perceived susceptibility. For instance, clients have identified that he is Catholic and has strong religious beliefs that explains his chances of getting mental health illness. He has also identified and visit natural healers for health-related issues. You then provide the initial date of the assessment and then follow-up date and observations. Now for the second one is the behavioral health values and beliefs checklist for practitioners. Here what we need to do is we need to identify the areas from the health values and beliefs checklist that you have not checked. So for instance, one of the items will be, I understand that preachers and spiritual leaders may be important during treatment and recovering. So if you have not checked that one, it means that you are in the process that you still need to find out ways to understand more about the spiritual leaders and their roles during treatment and recovery. Then you check the initial date and the follow-up and observations. The checklist. Identify which areas you haven't checked from the community checklist. So here you will list all of the items, for instance, that you have not checked. A list of natural healers in your target area, a list of indigenous healing resources in your community, and so on. Then you will have to put the initial date of the assessment and then the follow-up date and observations. And lastly, you have the risks section. So in this section, what we have is that whether or not the individuals seeking behavioral health services have completed treatment, whether or not it completed 75% of the treatment or withdrew from the treatment. The whole idea is to see how you use a culturally appropriate way of providing services through the behavioral health guiding questions, the practitioner checklist, and the community checklist. And by doing able to help the individual seeking for behavioral services even more by providing a very culturally appropriate service delivery.
We will now move back to in the last part of the presentation, we are going to cover 2 of the 7 vignettes within the toolkit. I will read the vignettes and Dr. Concha will elaborate if needed. Vignette number 1. Ibraheem is a 17-year-old high school student. Over the past year, he has had difficulty controlling his thoughts. The past few weeks he has begun to hear voices, even though he knows he's studying and working alone. He prayerfully addresses his worries multiple times a day. He has even been fasting, but over the past few weeks he has noticed the voices more frequently. Sometimes he becomes very suspicious of his friends and teachers and is now having difficulty distinguishing these voices from reality. He is starting to think this is a punishment from God. He has skipped classes at school and goes to a quiet place and prays that these voices go away. His friends have noticed that he has started to go for long periods without bathing or taking care of himself. He has seen mental health signs at school who to call if he needs help. There is no way that he ever thought it would come to this, but he's finally given in to talking to someone. Ibraheem knows that he must seek help and that he has a serious problem. He can't talk to his family. Ibraheem's family does not believe in behavioral health problems or agree with Western medicine. Ibraheem is hesitant to go to a doctor. What may be the perceived benefits and barriers of Ibraheem seeking help? Based on what you know, what are some of the spirituality questions you should ask? What non-judgmental questions would you ask? What would you recommend that would be acceptable to Ibraheem? What topics would you be extra careful about? What personal beliefs of yours conflict with this perception of the problem? How would you deal with this? What community resources do you need to have in order to provide a culturally appropriate treatment?
So in this section, some of the questions you have to consider, pay attention to question 1 to 4. You can use the behavioral health values and beliefs guiding questions to help you understand questions 1 to 4. Question 5, which talks about personal beliefs of yours may conflict with the perception of the problem, you can use the practitioner checklist for this question. And for question 6, what community resources do you need to have in place in order to provide a culturally appropriate treatment? You can use the community resources checklist for this. So everything that we have done through the checklist is to make sure that even throughout the vignettes, you can utilize the tools that we are presenting in this toolkit.
Vignette number 2. Liesel is 9 years old and has just moved from Ethiopia to the U.S. with her brother and father for her father's work. Her father brought her in to see a psychiatrist because he felt she was having extreme anxiety. Her father noticed that she was so anxious before the school bus came that she would get sick every morning. She was becoming so withdrawn that she would not eat. Recently, any open spaces seemed to cause Liesel extreme anxiety. The doctor decided after several visits to prescribe Liesel with a medicine that she could try orally. At the most recent visit, her father did not feel comfortable talking to the doctor about her prescription at the time, but he has strong feelings about prescription drugs. So her father decides to call her nurse back before giving Liesel the prescription. Liesel's father: "Hello, my daughter came in to see someone recently who gave her these poison drugs for her anxiety. She will not take them. My daughter will not be poisoned." Nurse: "What prescriptions was she given? Did she have a reaction?" Liesel's father: "I do not know, but I do not want to give her the pills. They give pills to people to poison them in the U.S. Nurse: "Yes, we can help you with a different prescription." Liesel's father: "We do not want a prescription. I want someone to help her naturally. Do you do that here?" What may be the perceived benefits or barriers, if applicable, for Liesel's father in seeking help in this example? Based on what you know, what are some of the stereotypes or stigmas about prescription drugs in Liesel and her father's culture? What non-judgmental questions would you ask Liesel's father? What would you recommend that would be acceptable for Liesel's father? What topics would you be extra careful about? And what personal beliefs of yours conflict with his perception of the problem? How would you deal with this? What community resources do you need to have in order to provide a culturally appropriate treatment?
So once again, you see the questions are the same questions that we are considering throughout all the vignettes. Make sure that you guys utilize the tools that are presented throughout the toolkit to answer those questions. Now, just to wrap this up, and just to make some final points. Throughout this presentation, we have presented the continuum. We have presented the first phase, which is the assessment tools. The second phase, which is the reflection. What do you do with the information that you gather from those assessment tools? The third phase is the implementation. So what do you do with the results of the information that you have obtained, and what can you do to make changes possible? So that's the last part.
Thank you very much for joining us on this webinar. Again, this webinar presented the materials covered in the Health Beliefs Toolkit. For even more information, please check out the Health Beliefs online course that is an extension of the materials presented in this webinar and in the toolkit.
So we are now open for questions. I think we have about 5 minutes for questions and answers. So if you guys, you can either use the chat or you can unmute your phone and ask any questions that you may have.
We have someone typing in a question right now, it shows. So let's wait for that to come in.
Okay.
At this point, participant lines are now unmuted, so if you have a question, feel free to ask.
Vivian has a question, and it says, early you spoke to the positive influence of religious beliefs. Sometimes religious beliefs can stimulate mental distress. What are your thoughts?
Yes, that is true. It depends on your approach and the type of religious affiliation that you may have that could also influence your mental distress. So it's always good to have a good relationship not only with the priest or the leader, but also with the support community, because sometimes the preacher or the leader may have a different approach and that your community in general may have another one. So make sure that if it is something that may not be that positive or maybe negative, make sure that you have another point of view from the community, from the religious community, that could help you with getting the information and the services that you may need. That will be my perspective about it.
Okay. And we have another question. How do you suggest organizations share this among their staff?
Well, that's a very good question. One of the things that I think that it should happen is through a training. You can have a staff training or a staff meeting and just deliver this toolkit and make a practice with your staff. And you can even play roles. For instance, some of your staff may be the individual seeking behavioral health services, and you can also do the practitioner checklist and have them discuss their answers at the end, whenever they feel that it's appropriate to share personal information or not. But that's something that it can easily be done during meetings. So is any other question, comments on how to utilize the toolkit? Yeah, so I think there's one more coming up.
It was a comment. It was a comment. Good point. It's also very important regarding Vivian's question when working with LGBT youth. The question regarding how
religious beliefs.
Yes.
And stimulate mental stress. Yes. So it seems that there are no other questions. Adelina, you want to add anything else before we wrap that up?
No, I think you guys have done a great job.
Great. So we would like to thank everyone for their participation in this webinar, and we look forward. If you have any comments on the toolkit, please let us know, and we'll be feel free to help you all or answer any questions that you guys may have. I think that Kathy is typing one more question.
Oh, multiple people are typing.
Yes, that's fine.
The question was, will the webinar be available? And the answer is yes. Adam, can you provide specifics about how the recorded webinar will be available?
Sure. Either today or tomorrow, we'll send a follow-up email with the recording link. I believe we'll also send out a PDF version of the PowerPoint, if that's okay. And we can include the Health Belief Toolkit again.
That's good.
And also I think Miriam is typing. Yeah, there are multiple people typing, so we're just going to wait.
And as a reminder too, the TA Telegram will contain the dates for the next webinar, which is in November, and also the dates for the Learning Exchange call. So check your Telegram. And the question from Michael Walker is, what would be the appropriate thing to begin sharing with your staff?
I think that you can share the whole toolkit with your staff because it has it's a very practical toolkit, and it has a different component, and it's pretty much made for practitioners. So it is good to share both the webinar, recorded version of the webinar, but also the toolkit, and have meetings with your staff and try to disseminate this information as much as you can. The more you read and the more you do the assessments, the more familiar you will become not only how to do them, but also how to reflect and how to do the implementation strategies as well.
One more. We'll take one more. I believe someone's typing right now. We'll take that last as the last one. Oh, it went away.
No, it's back.
Here's some book. I think that's it then.
Yes. Oh no, there you go. Very good. Will there be other detailed elements involving implementation strategies, processes pertaining to CLAS standards? There's going to be another webinar coming up, and I think Catalina mentioned this at the beginning of today's webinar, and it's on language assistance, specifically to CLAS standards 5 to 8, if I'm not mistaken. And that's going to be November 5th. Am I correct, Catalina?
Yes, let me check on the date.
I believe it's November 5th.
It's the 5th. Yes, November 5th, same time.
Same time, yes.
And then there's also we will have learning exchange calls once a month to follow up on the material from both toolkits.
I believe so, yes. This webinar will be available to be used as a training tool as well. I think to the extent possible that it can be utilized. Right, Catalina?
Yes, you'll have a PDF available of it, and then the recording, as Adam mentioned.
And there's also going to be the online course as well that is built on.
Yes, that'll be later on. Yes, that'll be, and then there'll be a detailed online course sometime probably the second quarter of 2015 or sometime in 2015.
On the same topic, on health beliefs and also language assistance.
Correct. And also, if you're looking for resources, these toolkits, as well as other resources that we have, are going to be on the CLC Hub library, Behavioral Health Disparity Library. If you need that link, we can send it out. I'll send it out right now. If you give me a minute, I'll get it. And I'll send it out via hang on 1 minute. Oh, it won't let me send the link this way. We will email that link. We will have that link available in the next Telegram. It doesn't let me cut and paste it. If you can also email one of us, I'm going to type my email, and if you need that link, just send me an email and I'll send it to you. I'm typing in this area. I think that's it.
I think so too. I believe Miriam is typing something. She may want to share or not. And she says, thanks a lot. All right. Well, again, thank you so much for your participation, and we definitely look forward to have the second webinar with Dr. Maria Elena Villar and Lauren Acevedo on language assistance.
Thank you.
Thank you.